Okay, so a few weeks ago, I hosted a dinner event for medical professionals, and during my presentation, I shared with them an alarming statistic that I couldn't quite believe myself, which was that 89% of medical practices have had patient data lost or stolen in the past 2 years. 89%. Whoa, that's crazy. Now, if you're listening to this podcast, you already know what HIPAA is, and if you work in healthcare, you know it's the law for your business to be HIPAA compliant. Let me share two more statistics with you that may help you to understand why so many people who work in healthcare still don't believe that that last statement I made is true. Okay, the first stat, 79% of all reported breaches come from healthcare. Whoa, that's another doozy. The second stat is 67% of those breaches involved a hacking incident. Now, when I see all these stats, the only logical conclusion I come to is that these healthcare practices are not taking HIPAA compliance seriously, or maybe just not seriously enough. Or perhaps it just seems too complicated and they're not exactly sure what they're supposed to be doing. I mean, after all, it's the job of a healthcare professional to take care of patients, not to worry about securing data, right? Now, while that may have been formerly true, it just simply isn't true today. The detriment caused not only to the patient, but to the overall practice and its larger patient base by not following HIPAA compliance requirements most certainly goes against the core value of excellent patient care. As of the date of this episode, there are currently 89 businesses under investigation by the Office of Civil Rights for HIPAA compliance violations in the states of New York and New Jersey, and 77 businesses under investigation in the states of Kansas and Texas. Nationwide, there are 867. Each of these can be found publicly by visiting the Office of Civil Rights breach portal, often called the HIPAA Wall of Shame. In today's episode, I speak with Brandis Kelly, president of the Technology Specialist, who specializes in healthcare technology support in Kansas, Oklahoma, and North Texas. Brandis will speak with us in great detail about common misconceptions that many small medical practices have concerning cybersecurity, compliance, and protecting patient healthcare data. She'll also walk us through a scary new threat that stands to impact all medical professionals and their associates as it relates to HIPAA compliance lawsuits. If you work in healthcare, this is an episode you don't want to miss. This is the podcast for hard-working IT people who love technology, cybersecurity, and access to the coolest new tech tools. Welcome to Legends of IT. Like Brandis's company, I too specialize in healthcare technology support, and so the topics we're discussing today are near and dear to my heart. So as I said before, Brandis runs a technology support company out of Kansas and Texas that works with small medical practices. And she has some wisdom to share with us today that might just blow your mind.
I'm Brandis Kelly. I'm president of the Technology Specialist. Yes, we are based out of Wichita, Kansas, but we are also kind of in Oklahoma and even North Texas. We're kind of spanning out a little bit. We are an MSP and we're very dental focused. We do also have a lot of finance firms, wealth management, CPAs, that sort of thing, as well as veterinarians of all things, and some manufacturing kind of trickled in there as well.
You mentioned a couple of different verticals there, but I do know you have a pretty big healthcare focus around dental, as you mentioned. So yeah, tell me, like, how do you help dental practices? What do you do for them?
Well, we are their outsourced IT provider. We help them sleep at night. We help them, have peace of mind and reassurance that we're taking care of all their IT needs, just like you would have a accounting consultant. We're their IT consultant, and they kind of lean on us for anything and everything, including, when they purchase like $500,000 equipment, like fancy schmancy equipment. Well, you get that in there and your computers don't work, you're probably going to be pissed. So they lean on us for quite a bit. We help them out quite a bit.
Yeah, that's awesome. Yeah, and I work in healthcare as well, so I know that there's like this crazy focus and this crazy intense need to have things fixed now, because you've got a patient that's sitting right there in dental. They're sitting right there in the chair. Something in technology doesn't work, and you got to get it fixed right away. So yeah, is that like, do you guys have a system or a process for how you handle and make sure those things get immediately resolved?
Yeah, so triage in that way, like you actually, you said it is patient in the chair. If there's a patient in the chair, they need it now.
I got to believe, because I know I've seen a few things myself, I've got to believe you've seen some crazy stuff and heard some crazy stuff. So like, what's one of the most head turning, craziest, I can't quite believe it things that you've ever seen dealing with some of these dental practices?
We had a couple ransomware remediations like right back to back within like a month and a half or so at the very beginning of the year. One of them was a client that we had marketed to for, I don't know, probably 2 years, and reading the notes, like go back and read the notes, and he says, oh, well, I'm the dentist, I'm very tech savvy, I can do all this myself. Like, oh, okay, that worked out for you. But then the second one, precursor, we actually went in late last year, and we kind of drew a line in the sand, and we implemented a new like XDR true managed SOC solution, and we forced it. So the choices were for our clients. We sent them an email. We said, okay, here's what we're doing. Here's why we're doing it. Here's why it's important. Here's the cost. It'll be on your next service agreement, right? So the other option is if you want to opt out, that's fine. Let us know, and we will help you transition to a provider of your choosing, because we meant it. Right. So we did have one single client out of like that 100-ish something or other that came back and said, nope, too much money, can't afford it, we don't need this. Okay, cool, we'll help you transition to a provider of your choice. And we did that. So 16 days, 16 days after that client, after we actually removed all of our security tools, support tools, everything, they called us to put Humpty Dumpty back together again because they got hit with ransomware. And Now they're a client again. They love us, and they actually are paying us more than they did before because, well, they needed it. They have all kinds of like a la carte add-ons now, so it's awesome.
Yeah, isn't that the story that keeps on being told over and over again? The client that says they can't afford it. That's a really good point, because I've heard that before myself. We can't afford this. Now, you and I both know that simply isn't true. The fact that they can't afford it isn't true. It's another way of saying, I don't want to spend that much money, so I'm willing to go and see what else is out there and see if I can get a better rate. But it never works out. One of the things with all of these medical practices is that they have to be HIPAA compliant. And like it's the law. It's the law. If you are managing patient health information, you are required to be HIPAA compliant. But I know, and you know, that a lot of them don't believe that's really true. So I'm curious, like, what is your take on a lot of these smaller, and they tend to be smaller medical practices that just simply don't believe that HIPAA compliance is a thing?
We really started pushing for HIPAA compliance back in late 2018, early 2019. And I cannot tell you how many clients laughed in our faces, like in our faces. And I legit had a client say, who's going to come get me? The HIPAA police? And what do you say to that? Like, I don't know. Honestly, unless they can like actually relate to something and empathize and truly put themselves in the position of either knowing someone who's gotten hit or being, hit themselves in any way, any type of security breach, HIPAA fines, whatever. It's just HIPAA schmippa. It's HIPAA schmippa in Wichita, Kansas. I tell you what. And I will say that things have gotten a lot better as far as the understanding. We definitely have a different approach now, but the one thing that really helped us was, this is kind of bad to say because it helped us, but at the expense of another MSP. On Black Friday of Thanksgiving of 2019, another MSP in a neighboring state got hit with ransomware. And that MSP actually was managing like over 100 dental practices, even some in Kansas, some that were actually related to our clients. So I'm getting phone calls like, this is what happened. Oh my gosh, are we okay? Are we protected? But now that story, now that it's relatable and it's been brought home, it's now in the middle of the country, right next door, up in Overland Park, like, people they know. Now they actually started to listen and, okay, maybe we do need to pay attention. Maybe we do need to try to get our ducks in a row and work towards getting this done.
It's funny how it takes hitting close to home before somebody perks up and actually pays attention to what's going on. And they don't want to believe it. I've even seen the situation where that happened in California, or that happened in Florida, or I'm in New Jersey. That happened in New York. We're not in New York. It's different there. Really?
That's pretty close.
I know.
That's closer to you are than to me. Yeah, that's
Your
pretty close.
data's less valuable apparently if you live one
Right.
state over than the guy in that next state. Yeah, it's amazing to me. I still don't believe any of it. I don't know what your take is on it, but I still don't believe any of it. I think these are all excuses to try not to do it because it's a prioritization of funds, right? I would rather spend my money on these other things. I'd rather get that new sensor. I'd
Yeah.
rather update my waiting room. I'd rather hire more staff, something along those lines, anything other than spending money on protecting themselves from something that never happened to them before, or in some cases has happened to them before and they just still aren't listening. Would you sue someone if it cost you nothing to file the lawsuit, amounted to almost no work on your part, and you had a good chance of making tens or even hundreds of thousands of dollars? What Brandis is about to share with us is a scary new threat that is beginning to impact medical practices across the country. And this is something that every medical practice needs to be aware of right now.
So when we're talking with our clients about compliance, and we actually say compliance as a culture, because it is a culture shift. Culture is what we're all doing without having to be told.
Yeah.
And that is why we call it compliance as a culture versus compliance as a service. But here's what we say when they're like, what's going to happen? HIPAA, schmippa, or the HIPAA police going to come get me. We ask them, okay, maybe not. I don't know. I don't know if you'll get caught by the government. I don't know. To be honest, I've actually heard that the HIPAA fines are actually going down versus rising. HIPAA fines themselves, right? But then I say, but have you ever heard of Qui Tam? And as an IT person, yes, I've heard of Qui Tam, but I've never gotten a yes from a client, by the way. And not everybody has. And I'm sure that there's a better pronunciation for it because it's Latin. It's from this like ridiculously long Latin phrase that I'm not even going to try to pronounce, but it essentially translates to he who sues on behalf of the king and also for himself. Okay? And guess who the king is in this situation? The king is the government. Okay?
Yeah.
So here's what that means. And here's what this is what we tell our client. This is basically a whistleblower rule. This means that if you've ever had a disgruntled employee that gets pissed off and wants to turn around and sue you, the employer, on behalf of the government, they can. And now all of a sudden, guess whose tail is wagging and ears are perked up and now they're listening. Because this brings, like I said earlier, you got to relate, you got to bring it home, you got to have them empathize, put themselves in those shoes. If you're now talking about a disgruntled employee, did you think of someone when I said that?
Mm-hmm. Mm-hmm.
Don't we all? Mm-hmm. Every single employer on the planet can relate, unless you're like, work for myself, can relate to having a disgruntled employee. And they actually can get, like in a Qui Tam action, they can get like 10 to 30% of the award if the government wins. And the government is the plaintiff. You're the one saying, hey, I worked for this dental practice. I know for a fact that, here's an example, I know for a fact that they do Medicaid. They offer Medicaid insurance. Like you could use your Medicaid there. Mm-hmm. And by the way, if you're using Medicaid at your at any health facility, and you better pay attention to the fine print, it says that you're supposed to obey and comply with all rules and regulations of the government. Mm-hmm. Guess what a rule and regulation is of the government? Bring in HIPAA. So you're saying that you're doing it, you're reaping the benefits of it, but you're not doing it. That's actionable, 100%. Yeah. All it takes is pissing one person off. And they could get like between 10 and 30% of the awarded judgment. About a year ago, there was someone who had a Qui Tam action that got $200 million.
Wow.
$200 million.
Wow.
Honestly, I'm in Kansas. $25,000 would be enough for probably anybody to say, you know what? I work for this guy and he's not doing what he's supposed to be doing. Yep. It's that easy.
Payday.
And there are lawyers all over the place, ambulance chasers. Google it. They're all over the place. I mean, it's like trying to get, when you have the car, have you been in a car accident? It's the same idea. It is definitely a thing. And, it's actually been around for a few years, but it's gaining a little bit more traction because people are starting to talk more about it. And gosh, I mean, you're sitting there, you just got fired, you're angry, you're filing for unemployment. Well, what can I do? And punch it into Google.
Yeah.
It's going to pop up along with like 12 ads of who you can call.
Another threat facing medical practices today is the subject of cyber liability insurance. Compliance practice is now coming into play as it relates to an insurance carrier's willingness to insure a small business, and many businesses are now being denied cyber liability coverage because they cannot prove a culture of compliance. How do you help these small medical practices that I know we talked a little bit about the ones that don't buy into it, but what else can they do? Like what other options do they have to try to get over this? Because I think the thing that's in everybody's mind is how it's just so expensive. It's so much money. Like I don't know what the return on investment is for all this money that I'm spending for these tools that this MSP or IT vendor is trying to sell me. So like how do you guys handle that?
Okay, so we have two different options that we're going to our clients with, and we've been doing this for about 3 or 4 months now. So we're either saying, if you really like your local insurance guy, he's like whatever, your brother-in-law, and you love him, then put us in touch with him. We're kind of cultivating like a JV partnership there. Put us in touch with them. You know, Mr. Client, I hate saying Mr. Customer because it seems just kind of like strip clubby to me. So Mr. Client, when you filled out this, when you filled out this insurance policy, we weren't present to see what you were saying yes to, what you were saying no to, what boxes you were checking. We don't know what you signed up for. So what we really want to do is just get in touch with your insurance provider. We want to walk through everything you said you were doing, and we want to make sure that you're doing these things. Because the alternative option is, if you don't like your insurance guy, send us your documents, send us your policies, and not just cyber liability insurance. You can send us E&O, you can send us crime, you can send us whatever. We want them to understand what they already said they have. If they have any gaps that we need to fill or holes we need to plug, let's get those plugged right now. Because if something happens, we don't want to give them a reason not to pay you out.
No, it's a big thing right now. And I think not just HIPAA compliance, because if one of these small medical practices doesn't want to listen to why that's necessary, it's cyber liability insurance. That is driving people to make a change, because when that insurance broker shows up and says, here's what's required, here's what the carrier is requiring of you, and we're not going to insure you because you're not doing these things. In fact, I had somebody he was getting a quote from an insurance carrier, and they did a scan of his website. Had nothing to do with us, but they got a scan of his website. They found some vulnerabilities with his hosting provider and said, we won't give you insurance. We will not give you a policy. One had almost nothing to do with where his actual data was. The website's all just fluff and crap. Not crap, but you get what I mean.
Yeah.
But yeah, they wouldn't do it. They wouldn't do it. And so that's what's going to happen. And if you can't get cyber liability insurance and you get that ransomware attack, guess what, Mr. Client? You're screwed. Like,
Yeah.
Can you afford to pay $500,000? Do you have that much? Like, what would happen to your practice?
Yeah, and there's a number associated with it. I feel like it's in the $100-ish, but it's per chart. So if you've got a dentist that's been in business, has had the practice for 10 plus years, I mean, they could potentially have thousands of charts. And then that's how you get that multiplier. It's like $100-something or something like that.
Another objection that both Brandis and I come across quite frequently as it relates to HIPAA compliance is the idea that having your data in the cloud makes you safe. And because you're working with a medical records management cloud service, they have your HIPAA compliance taken care of. But What would you say to the medical practice that responds with something like, we use a cloud medical records management system, and they handle all of that HIPAA compliance for us. We don't need to do anything else.
You do realize that that's still somewhere, right? That's still somewhere. I mean, AWS has gone down how many times? You don't think that they have a huge target on their back? Microsoft has one of the biggest targets on its back of any vendor. I mean, they're constantly reporting breaches. Why do you think they have so many patches? Because everybody's trying to exploit them. I mean, they're trying to find the holes in that. Just because you're in the cloud, like there's still data transmission. Are you doing everything in the cloud? Like, I mean, it's never 100%. It's never 100%.
Yep. And I think they're missing the stores, processes, or transmits electronic patient health information. It's right in there. Stores, processes, or transmits. You have computers, you have a network, you have an office, you have sensors, You have all of these things that are either storing, processing, or transmitting some level of patient health information. And that means that they're all in scope for HIPAA compliance.
Yeah, and we actually have a few, quite a few clients that have, I don't remember if it's a 3D cone beam or it's a Pano machine, but they actually come with it doesn't matter if you're using a cloud platform or not with your dental software. Everything is still housed in this little, like, I don't know, it's kind of like a NAS unit, to be honest, but it's like the machine for that particular, for all those images.
Yep.
All of it.
Yep.
Yeah.
And that brings up the topic of IoT devices and all of the different things that get plugged into these networks and how safe and secure are all of those devices. And anybody anywhere can come in and plug one of these devices into the network because there's a network jack and bing, bang, boom, or there's the wireless network and let's connect it up. The fear that I have is that most of them don't understand how to ask the right questions to know whether or not they've got the right things in place. And when you come in and you talk to them for the first time, they don't trust you. They don't know you. You know, because you can look at that network. You can spend 5 minutes looking at that network and go, there it is. I can see it. But you're not going to believe me when I tell you that you're missing all of these things. And that's, I think, where compliance can really help too, because it gives you this kind of this framework for what is and what isn't and where you need to be. And if you're not doing that, how can you really know?
Yes, and again, that's why we focus on the culture shift.
Yeah.
Because compliance isn't just, at least HIPAA, actually neither is PCI, and I guarantee you neither is CMMC. So it's not just filling out this massive baseline assessment in this huge book telling you how shitty you are, and then you dump it on a shelf somewhere, and then you do it again next year and see if you've, it's not like that. It is a culture shift, and everybody has to change how they're doing things, and it's got to be expected that there's going to be changes around here. We all have to get on board on that, because I shouldn't have to worry about Nancy constantly freaking saying, save password on her Google Chrome account all the time, or writing her passwords on her desk, or patient information all over the place. Like, there's so many different controls and systems that you have to have in place. It has to be a culture shift. Mm-hmm. That's how we are selling it, and everybody, it's like lights are going off. Like, they get it. You're right. I get it. It's not just a book we fill out. We have to actually change how we're doing it. We have to put the seatbelt on when we get in the car. And
if not, that little ding is going to go ding, 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 driver seatbelt.
So annoying.
No. So don't you want that ding to go away?
Yes. Yes.
So what's one piece of advice you think, the most important piece of advice you'd give a small healthcare practice, or let's say any healthcare practice? Maybe it's a small one, maybe it's a medium-sized one that actually has IT already in place. Like, what's one piece of advice you'd give them from the compliance perspective that you think would help?
We're very relatable to our clients. I've talked about this multiple times. Bring it to their level, meet them where they're at, make them understand, have them in those shoes. So we don't say things like network assessment, vulnerability scan. We don't say things. We say we need to take an X-ray of your network, and we're going to put together a treatment plan of your network versus an action plan or proposal or whatever. So we also use the phrase continuing education, because guess what? In the medical field, in any medical field, you have to have it. So many credits for whatever you're doing. And so we draw some parallels to continuing education. You have to have continuing education, because the way that they do a crown today is 100% different than the way that they did it 10 years ago. You have continuing education for you and your profession. We also have continuing education for us. We are constantly having continuing education and learning the different, threats that are coming out and how to combat them. And so we also are able to continuously educate them, saying, hey, we need to sit down and we need to just go through some continuing education. Here's where you're at. Here's where we need to get. Here's how we're going to get there. Let's plot this out. Let's create a treatment plan.
So back to this dinner I hosted a few weeks ago for healthcare professionals. While I was speaking, one of the attendees stopped me and said, wouldn't it just be easier to go back to paper charts? Healthcare, like any other business, must understand its target market. The modern patient wants all of the information available to them immediately and wants it delivered to their mobile device. This means the security rule portion of HIPAA, which specifically governs electronic patient health information, is more important than ever. HIPAA compliance requirements aren't going anywhere, and as a matter of fact, the safeguards required of healthcare practices are likely to become even more strict in the future. That being said, HIPAA doesn't have to be painful. As Brandis so eloquently put it, HIPAA compliance must become a culture in healthcare practices across the country. Then and only then do we stand a chance of significantly improving on those alarming statistics, and even more importantly, improving how we protect the patient. A great big thank you to my guest today, Brandis Kelly, President of the Technology Specialist. And a great big thank you to our listeners and viewers for tuning into our show today. We sincerely appreciate it. If you haven't done so already, please subscribe to Legends of IT wherever you consume podcasts. This way, you'll be notified as new episodes become available. Until next time, on Legends of IT.